with Urology San Antonio. There's actually 24 guys in my group. We're actually 21 guys and 23 gals. We cover the city, have offices at the Northeast, the Southeast, the downtown, the medical center, and out at the North Central. And so probably some of you know some of my partners. But what I wanted to talk to you today a little bit about was just men's health issues. I call it what men need to know and what men a lot of times don't want to know. We're very, how shall I say, we're pig-headed. A woman are very used to going to the doctor. They get their pap smears and their breast exams every year, and that's why they outlive us by an average of about 8 years. We men getting us to the doctor, you got to put a gun to our head, or, basically we have to be pretty much dead. But I want to talk about 3 of the most common issues that I see in men. Some of these issues are exceptionally easy to treat. Some of them are a little more complicated, but have made a real impact on men's lives. Those are the things that we commonly hear in the news today. Prostate cancer, enlarged prostate, which is also called BPH, and erectile dysfunction. So let's start off with the big thing, prostate cancer. Let me just give a little background about what the prostate is. The prostate is a gland that you can see here in the drawing. It basically is shown here. The prostate's basic function is to make secretions for ejaculation. This is the prostate here, and basically the bladder is above it, the urine is here, and the urine comes through the middle of the prostate and out when you urinate. It's like I said, its main goal is making fluids for ejaculation. Most of us men, once we go through the childbearing years, our prostate just is not doing us much good except getting us in trouble, and it goes on and causes a lot of problems. So what is prostate cancer? A background, what is cancer? Cancer are basically cells growing out of control. I give people this analogy. When you think about cancer, think about your grass in your yard. You got grass, it grows, and occasionally you get a weed, and it just starts growing out of control. And that's what cancer cells are. They're cells that are growing out of control. People say, why is this? There's a lot of theories about this. One of the biggest theories, and I explain this to patients, is we make cancer cells throughout our entire lifetime. Our body's immune system recognizes those cancer cells and kills them. What happens in some of us as we get older is we develop cancers, and that's why we tend to find, particularly in certain types of malignancies, the younger you are when you get a cancer, the more aggressive they tend to be. Because as we get older, our immune system doesn't work as well. That's why we get more, as you get older, you get more prone to get cancer. When young people tend to get cancer, they tend to be more aggressive, more high grade, and be a problem. So that's what cancer cells are. They're cancer cells or cells that are growing out of control. Now, prostate cancers are cancers that start in the prostate. We talked about this earlier. They usually start small. They are usually very indolent for a long period of time, and then they begin to grow. And so getting them early is the big key to treating them. They generally start in the prostate. They extend out locally to the lymph nodes, and then they can go to the bone and the other parts of the body. Here's some cancer facts I think very, very interesting. It is the leading and the #1 cancer diagnosed in American men today, by far. But it is the 3rd leading cause of cancer deaths. #1 cancer death is still lung cancer, and #2 is colon cancer. Prostate used to be #2. If you actually look at the incidence of prostate cancer, it keeps going up, yet the cause of death is coming down. And the reason for that is early detection and early treatment. If you look at men across the nation, we're living longer. There's no question. The statistics show that we're living longer, and that 1 in 6 men will develop prostate cancer. We can talk about that in a minute, because in the older man, and I used to think what was old. I mean, I can tell you, when I was 12 years old in the church youth group that I was in, I thought people 20, they knew the ways of the world. And when you're 30, man, you must be just ready for the nursing home. And one of the girls in my office, they told me, she said, I'm turning 30. I said, you're a child. I have shoes older than you at home. So it's what is old. But I want to talk just a bit about what is the, quote, older man and the incidence of that. There's over 40,000 deaths each year attributed to prostate cancer. The problem that I get in when I discuss with men about prostate cancer is guys say, doc, I'm not having any symptoms. I don't have prostate cancer. And my #1 answer is the #1 symptom of prostate cancer is there are no symptoms. If you show me a man that has, and I said this one, who has symptoms from his prostate cancer, that's a man who's in big trouble. Early detection is the key. There's no question that so many guys say, I feel great, I'm not having any problems urinating. I see this on the advertisement for certain medications and certain screenings. If you're having symptoms, notify your doctor. That's a problem, because most of the guys I see don't have symptoms, and that's when you want to get it, is before they have symptoms, so that you can treat those guys and that they will do well. So who's at risk? Every man is, but there are certain age groups that are higher than others. Men over the age of 50. Race does play a role in this, no question. African-American men are at a much higher rate than Caucasian men, and a family history. There is some incidence that shows that diets high in saturated fats may increase the risk. What I tell men is this. if you have a first-degree relative, that is a father, a brother, a cousin, or an uncle. Really, cousins are secondary, but brother, father, or uncle have prostate cancer, you have an increased risk. You show me a man, there's been some studies to look at. If you have 2 first-degree relatives, your chance goes up. If you have 3 first-degree relatives, so if you're a man here and say, hey, my father had prostate cancer and 2 of my brothers had prostate cancer, I can almost guarantee you you're going to get prostate cancer. Had a guy in the office the other day. He had prostate cancer, his brother had prostate cancer, and the other 3 brothers, all 3 got prostate cancer. And I told his boys, I'm probably going to biopsy you when you're 40. I mean, and he was a black gentleman too. So the risk is much higher. If you show me a black gentleman that has a family history, even more high. My father had prostate cancer, so my risk is higher. So there's no question that it is. Diet, there's been a lot made of herbal supplements, vitamin supplements. The only thing we know for sure, there is some data that supports that zinc, which is found in high concentrations in your prostate, may help, and selenium. But there's been no definitive answer, does it prevent prostate cancer? I know you see guys touting their supplements on TV. It's your money. You know, P.T. Barnum said there's a fool born every minute. So if you want to spend your money on it, you can. There's been no data to support that really makes any difference. So early detection, like I said earlier, is the critical part. Now, what are the early detection? PSA and digital rectal exam. Now, PSA is easy. It's a blood test. Draw a little blood out of your arm. We send it off to the lab. Digital rectal exam, as you said earlier, the finger makes men most nervous. Let's back up and talk about PSA first of all. PSA is a simple blood test that we do. We draw the blood. We check it. Little discerning information here. You know, if you read the data, it's basically, my PSA is less than 4. PSA less than 4, when Yang sort of developed this back in the 1980s, it was 79, you looked at, they did thousands of men, they figured up the PSA, and the average PSA was about 4, and that's kind of what they went with as normal. That's not necessarily normal. What we found now is there's what's called an age-specific PSA, which tells me, man walks into my office, he's 50 years old, and he has a PSA of 4. I am very nervous about that man. Man walks into my office, and he's 75, and he's got a PSA of 5. I'm probably not worried about that guy. We know that as you get older, we'll talk about this in a minute, your prostate enlarges, and so the PSA does go up. So what we're showing now is that any man that I see in my office under 60, and a lot of my guys under 65, if their PSA is less than 2.5, they probably need a biopsy. Because what we have found is that if you wait till it gets to 4, that the risk of missing a cancer is significant for those patients. The digital rectal exam, people say, why can't you just do the blood test and skip the digital rectal exam? And the answer to that is they go hand in glove. I can't tell you the number of guys that come into my office that have an abnormal PSA, which is still the most common reason we find the prostate cancer, have an abnormal PSA but a stone-cold normal rectal exam. But I have a significant number of men who have a stone-cold normal PSA. When I feel their prostate, I said, you know, this isn't normal. A very good friend of mine from church called me and says, hey, my primary care doctor needs to send me to see, my PSA is 1. And he found something irregular on his prostate exam. And I said, yeah, this is abnormal. Sure enough, he had prostate cancer. So you can't just use one without the other. They are working on some new and more specific blood tests, not available yet. We hope that in the future we will have a blood test or a particular test that will alleviate doing a biopsy. But until now, if one of these is abnormal, you know, the gold standard is a biopsy to make sure. Like I said, the PSA is a simple blood test, and we just sort of touched on the issues of the fact that it's measured. It's a protein made by the prostate. And like I said, 0 to 2 is about normal for any man under about 60 to 65. Now, there's been this real debate on what is normal and what is not normal. It varies, and we know this. And doctors, we know that it's not 100% normal. I have guys that have PSAs that are, you know, kind of on the borderline, and I may repeat them. Some guys walk into my office, a guy today, 59, and his prostate PSA was just a touch high, and so I may repeat that PSA and just see, because I don't always go by 1. But, you know, guy today, PSA was it wasn't too bad. It was 2.5, 2.3. But his father had prostate cancer, and his prostate didn't feel normal. Those guys need a biopsy. Biopsy is pretty simple. We do it in the office. But when you're considering how to, and that's part of the art of medicine. Medicine is not a science. It's an art. And every person is different. Every client is different. You kind of have to meld that and come up with what works best for those patients. So the digital rectal exam, this is what most men fear. Basically, it's a very simple exam by which you take a finger and you put it in your bottom. It should not hurt. It should not be uncomfortable, but it gives us an idea. There's a lot of things we pick up. Abnormal prostate exams. I get several guys that come to see me on a regular basis. Every year I find 1 or 2 guys. They come in to get their prostate exam. They're a new patient. They're somebody sends them over to see me, their mother, their wife, somebody, and I do a prostate